Hi, everybody. It's 4 p.m. on Thursday, the last day we're going to get together this week. And remember that we're going to get through this. We're going to get through this together. That's something we need to hear today because our COVID report is very difficult today as the pandemic continues to escalate. Today, we'll also talk about red zone counties for the next week that'll be asked to follow those red zone recommendations, the school recommendations, the long-term care recommendations. We're going to again run through testing opportunities that are out there because with so many red counties, we need people to get tested. We're going to walk through how we plan on spending the remaining CARES Act money and where it's been allocated thus far. And we're going to get an update on COVID in our prison system here in Kentucky. So a lot to get through. Most of it's going to be really difficult. But let's first start with good news because there is still good news that's out there. So I was sent today's mask by Riley. Riley is a 10-year-old that wanted to make sure we all were aware that November is Pulmonary Hypertension Awareness Month. And Riley, who I think we have the picture that Riley sent to us, Riley also sent a letter in green. She says, "Dear Governor Beshear, my name is Riley Weigel, and I live in Lexington. I just turned 10 years old last Tuesday, September 8th. I sent you a card and colored page back in April, and thank you for that. I have a rare life-threatening disease called pulmonary hypertension. PH is a disease that causes the pulmonary artery to become narrow, causing the right ventricle to dilate, possibly leading to heart failure or death. November is Pulmonary Hypertension Awareness Month. My family and I are always looking for ways to raise awareness. I wanted to send you a mask to make you aware of pulmonary hypertension and raise awareness to others. I work with my mom and a company called Brave Gowns to design this mask and create a campaign for Pulmonary Hypertension Association to raise money for her friends, her PH friends. I hope you like your mask. Says, I appreciate all the hard work to keep me and others like me safe during this pandemic." And she ends with, "We're going to get through this, and then we're going to get through this together." You know, you might ask why I think this is good news. It's that we got people like Riley that are out there fighting for others going through the same thing that she is going through. This is really special. Riley, you are an amazing Kentuckian, and I'm going to wear this mask to keep you safe, and everybody out there ought to wear masks to keep Riley and her PH friends safe as well. All right, another piece of good news is based on providing some relief to our small businesses that have been hit the hardest, our restaurants and bars. So at the start of the coronavirus pandemic, I asked all of state government to look for creative ways to improve customer service and provide financial relief to Kentuckians who have been severely economically affected by this emergency. Today, I'm happy to announce a step we're taking which will save some money for bars, restaurants, and temporary venues, all of which have been hit really hard by decisions that we've had to make in this virus, like capacity limitations. But they've also really been hit hard by the virus that can make those locations, if we don't take steps, like those capacity limitations and masks, it can make them unsafe. But there's no question that these businesses have shouldered a lot of financial burden to protect our families, and they've had to shoulder a lot more of that burden than certain other businesses. But by doing the right thing, they've saved lives, and they've had to put their financial interests, maybe their dreams in that small business aside for the lives of those around them, and that's an incredible sacrifice for humanity. So I'm pleased to announce that the Alcoholic Beverage Control Board with the state's Public Protection Cabinet is granting 12-month relief on alcoholic beverage renewal fees. For those that have not paid their renewal fee this year, 2020, you don't have to pay until 2021. If you've already paid in 2020, your fees will be waived in 2021. This fee waiver is an extension of the work ABC has been doing throughout this emergency. Previously, they extended time for the payment of these licenses. It's important to know that the waiver doesn't apply to producers, distributors, wholesalers, and others which were able to continue their operations through the state of emergency. And the goal is to provide some economic relief to restaurants, bars, and other venues that have had to close or reduce their capacity or change their hours during COVID. I want to thank them, everybody that's doing it right in those areas, and that even when it's hard, have stuck with it. Because if you have, you've created a safer environment for those that are coming. And I'm going to ask folks out there, not just in red counties, but in others, make sure you prioritize the businesses that are doing it right. You read some stories about some restaurants requiring masks when people come in and customers refusing to go there. We need to do the opposite. It's the safest place if you are going to go out to eat, to go. But let's also reward people again for putting the lives and health of our neighbors first. I want to thank them for being a part of Team Kentucky, and we're going to keep trying to find ways to support them and others, including my support for federal assistance directly to them. All right, Fish and Wildlife has some good news to share. We didn't get to talk a lot about this in many of the months that it was occurring, but they have shown real innovation during this pandemic and continue to provide great educational programming online for Kentuckians. Sometimes a pandemic like this makes us think a little differently, and then we see some really positive things coming out of it. So the Salado Wildlife Education Center's Facebook Live educational programming was a huge success. From March to early May, they had 63 Facebook Live events reaching 1.1 million people more than would have ever come directly to the center during that period of time. It was about boating safety, catfishing opportunities, virtual tour of the Pfeiffer Fish Hatchery in Frankfort, and turkey calling. Those were some of the most popular ones. And each programming is archived on their YouTube channel. So especially as we reach some colder months, it's going to be an opportunity not just for our outdoors men and women, but also educational opportunities for our kids, something real positive that we can do with them. And that leads into the virtual learning resources for educators and parents. So the conservation educators at Kentucky's Department of Fish and Wildlife developed a ton of new resources to assist teachers and continue the education of students in the fields of hunting, fishing, wildlife conservation, and they did it all in a virtual format. It's free distance learning resources, which include video segments, worksheets. It allows parents and teachers to help students make meaningful connections and discoveries about the natural world around them. Those are available at fw.ky.gov. They also did a virtual conservation camp. More than 570 kids age 8 to 14 participated. A lot of activities there. Keep up the good work. This shows that even during difficult times, sometimes it makes us stretch and think about different ways to reach people. This is going to be a part of, as we come into a legislative session in January, what we're going to be asking, among other things, for this General Assembly to consider. We have an opportunity to modernize state government. We've been having people driving to Frankfort from Paducah or Harlan just to take an exam that they can now securely take online. We may need some regulatory and statutory changes for things like that, but new opportunities that in many ways lessen the space between far western and far eastern Kentucky and Frankfort, that allow people to have more opportunities more conveniently. It's a chance to bring government not only into the year 2020, but if we do it and we do it right, I believe can give us competitive advantages on other states. We've had to learn so much about how to operate, and we can operate more efficiently right now. We need to make sure that we take advantage in this next session to make sure we are realizing all of the potential, the opportunities, but also the cost savings that are out there. All right, finally on the good news front, and this will be the last piece of good news today, just want to highlight some people that are out there doing it right, wearing their masks, because we need a lot more people doing it. So first, this is John Kevin Holbrook. Again, encouraging everybody to wear their mask to protect family, friends, and others. Thank you for doing that. And here's the Bardstown Bourbon Company enforcing these mask mandates, making sure that people stay safe, and showing that if we do this right and we all work on this, that we can continue to have certain opportunities. But today's COVID report is gonna show you that when we refuse to, things get really dangerous. So that's where we are today. Today, again, shows a concerning escalation that means we just need more out of everybody. Now, I will say I'm seeing more communities coming together on the red zone recommendations, and so I have certainly hope moving forward. But for any community right now that's saying, we don't really need to do those recommendations, we just need to say, people, please wear your mask and wash your hands, that's not enough. It's got to be a concerted community effort everywhere that this virus is out of control. Because today, we have 2,318 new cases of COVID-19. The only time before that we were above 2,000 is when we had a big backlog from Fayette County. There's no backlog in this one. We're not only over 2,000, we went way over 2,000. This is far, far too many cases. You remember when we heard of 1,000 cases and it was striking and it was worrisome. I remember back when 100 cases was. We went from 1,000 cases to 2,000 cases, well, to 2,300 cases, far, far too quickly. It shows that the widespread community spread is not controlled, and it's going to take a lot more buy-in and action from us. Brings our total number of cases since March the 6th to 115,277, and every other concerning number is going up. Current number hospitalized going up, 1,102. If we just go back to October 22nd, that was in the 800s. Number of Kentuckians currently in the ICU going up. It's 291 today, October 22nd, 214. Number of Kentuckians on a ventilator going up, 129 today, October 22nd, 105. Positivity rate going up, 6.5%. New cases by county. When you have this many cases, there's a lot. But I'm going to go through all of them with double digits because I think it's important that we highlight how widespread this is and that it's in your community. Jefferson, 444. Fayette, 177. Kenton County, 95. Hardin County, 82. Boone County, 55. Most all these are the highest numbers ever in these counties. Nelson County, 52. Boyd, 50. Barron and Campbell, 49. Bullitt, Davis, 47. Madison, 44. Floyd, 37. Christian, 35. Laurel and Warren, 34. Grayson, 29. Jessamine, 28. 27 in Graves and Montgomery. 25 in Marion. 24 in a number of counties. Breckenridge, Greenup, Henderson, and McCracken. 23 in Callaway. 22 in Monroe. 21 in Oldham. 20 in Shelby. 19 in Hopkins and Perry. 18 in Marshall and Taylor. 17 in Pike. 16 in Clay, Hart, and Whitley. 15 in Knox, Meade, Mercer, Pulaski. 13 in Lewis, McLean, and Powell. 12 in Bell, Boyle, Grant, Scott, and Woodford. 11 in Harlan, Ohio, and Spencer. 10 in Adair, Carlisle, Estill, LaRue, Muhlenberg, Washington, and Wayne. A lot of other counties with significant number of cases. They're online, kycovid19.ky.gov. So when we have more cases, especially a huge number of cases like this, more people end up in the hospital, more people end up in the ICU, more people end up on a ventilator, more people end up dead. So today, in addition to announcing 2,318 new cases, I have to announce 20 additional deaths. Those are 20 Kentuckians that are going to be missed by their family, that are taken too early. It's a lot of families that are going to be in pain, and we need to be there for them. Please reach out, because I guarantee you know some of these families. I do. And all it takes is asking people how they're doing right now, and you find out that somebody has a family member in the hospital or struggling. So the 20 Kentuckians that we have lost today include an 81-year-old woman from Boyd, a 71-year-old man from Breckenridge, a 52-year-old man from Bullitt, an 83-year-old man from Carroll, 2 women, 194 and 186 from Christian, 76-year-old man from Davis, 75-year-old woman from Fayette, 102-year-old woman, 80-year-old man, 90-year-old woman, 78-year-old man, 78-year-old woman, an 83-year-old woman, and a 62-year-old man, all from Jefferson County. County is getting hit really hard. Our hearts go out to you. A 93-year-old man from Laurel, an 81-year-old man from Marshall, 83-year-old man from Martin, 81-year-old woman from Martin, and a 71-year-old woman from Muhlenberg. That is a lot of pain. It's a lot of hurt, and it's all real. So let's light our homes up green. That's the least we can do. And, you know, for those that don't have that green light, go get it now. I mean, with what the next couple months are going to look like as we work community by community to get control of this, it'll send out a little bit of hope to others. We're going to continue to light that Capitol Dome up green until we don't have deaths related to COVID anymore. And when we add that number, today's number, to our overall numbers that are out there, we've lost 1,534 Kentuckians. Far too many. Let's remember, these aren't ages and genders, counties on a spreadsheet. They're real individuals. I mentioned that we lost a healthcare provider just the other day. I want to tell you about him. On October 31st, Kentucky lost Dr. Muhammad Jawed, a loving father to 3 daughters, a beloved husband, and one of our frontline healthcare workers. He passed away peacefully early in the morning at the age of 59 after battling COVID-19 for over a month at the University of Kentucky Hospital. Dr. Jawed was born on August 2nd, 1961 in Pakistan, where he grew up and attended medical school. He completed his residency in New York and then moved to Corbin, Kentucky in 1997. He humbly served the southeastern Kentucky community for 23 years as a well-respected physician. He is a true hero. He was battling multiple myeloma, a cancer that affected his plasma cells over the last 2 years while continuing to work as a frontline healthcare worker, even during COVID-19. He dedicated his life to supporting his family and caring for his patients. He's survived by his 3 daughters, Gazelle, Hannah, and Fareen, and his wife for 25 years, Landon Hassani. His family shared their love for him so much, and he will dearly be missed. That's a lot of courage, isn't it? To be battling something like he was, but to say, I'm needed now, maybe more than ever during this COVID pandemic. That's sacrifice, a sacrifice that's going to be felt and borne by his family. Let's make sure we honor that sacrifice by wearing our masks, by following the recommendations, by doing everything we can, because if he's willing to give his life in service, the least we can do is put on a mask to respect that sacrifice and make sure that others don't have to make it. To his family, we are so sorry, and we're thinking about you. All right, with that many cases and that much loss, as you can expect, we have a number of red counties that here being Thursday, at the end of Thursday, we'll set the counties for following our red zone recommendations, recommendations for schools, and recommendations for long-term care. Let's show the map first, James. Folks, we're down to just 2 yellow counties. And today we have 80 red counties. That means virtually the entire state is seeing a significant surge. But it means for these red counties, it's dangerous out there. It's dangerous to you personally. It's dangerous to those around you. It's dangerous to especially those most at risk from this virus. So what does it mean to be in a red zone? Can you put up the recommendations? It means that first, we have school recommendations that you learn virtually for this next week starting on Monday. Second, it means that long-term care visitation is going to be further restricted because it's a dangerous time. We want to keep that virus out. Third, it means we're asking every business in every red zone to allow as many people to work from home as humanly possible. It's going to be needed both so that they can support their families, but you're also risking an outbreak in your facility or your business during this time. Government, and that is local and state. We're asking you to move to fully virtual unless there is something that is a necessary essential service that has to be provided in person. Public events, private events, postpone anything that you can. Don't have any gatherings. Don't have people over if you are in a red county for this next week. Again, we see more spread at gatherings like that and family gatherings than anywhere else. And right now it is that elevated in your community. And wear a mask at all times when you are out in public. Please. It is that dangerous right now. Following these recommendations gives the best chance for your community to get out of the red, but also for you to protect your health and the health of your family at home. So if you are in a red county, stay home as much as possible this next week. Support your local businesses by takeout and carry out. Please try to support them the amount that you otherwise would. But if you are in any of these 80 counties this next week, we need a lot of work to get cases down. You can read them there on the screen, given that they're 80. I'm not going to read through them out loud, but this ought to set next week. And let me say, if every community on here can and will do this, with 80 communities doing this through the next week, and many of them having just done it through this week, we can have a very significant and serious impact on slowing the spread of the virus. This is about 2/3 of the state. This is an opportunity. This is an opportunity to really slow the spread of the virus, but we need your help. Again, it's asking a lot for a lot of communities, but it's not asking a lot in the middle of a global health pandemic that's taken over 1,500 lives, and right now at the escalation will take over 1,500 more. If we can't do this, if we don't follow the recommendations and the guidance, we know what'll work. We just need everybody willing to do it. The other thing we need in red counties and other counties is for people to continue to get tested. If you're in a red county that's listed right there and you've been out, go get tested. It is that widespread in our communities where we need you to do it. If you're in the Louisville area that is in many ways hit the hardest, you have a ton of different options, including surge testing that the federal government is helping us with at the Kentucky Expo Center. That is funded by the federal government. We want you to take advantage of it. Lexington starts November the 16th. Again, this is, we pay some administrative costs, but basically free to the state because the federal government sees how much virus we have. There are very short lines in this one in Louisville. You can sign up probably even for tomorrow. We're averaging about 200 tests a day. We can do more. So again, go to that website, and it's all on kycovid19.ky.gov, 9 to 5, Monday through Friday at these sites. They can test 200 to 300 people a day, so we can do more. Other sites that are being supported by the state: Purchase District Health Department, providing testing in McCracken, Ballard, Carlisle, Hickman, and Fulton counties. Please take advantage of it. A lot of red counties in that area. Ashland Boyd Health Department, Boyd County is red this week, is providing testing opportunities for Boyd, Greenup, Carter, and Lawrence County. They'll be testing in Lee, Wolf, and Owsley through the Kentucky River Health Department. Kentuckians in Hardin, Meade, LaRue, Nelson, Marion, Washington, Breckenridge, Grayson. Oh, Rachel, I'm doing that really fast. My apologies. And other counties in the region can get tested through the Lincoln Trail Health Department. In northern Kentucky, Gravity Diagnostics, St. Elizabeth's Physicians, and St. Elizabeth Healthcare are partnering to provide testing sites at Erlanger and Alexandria. And there is more testing in Louisville through Norton Healthcare and U of L Health. Please, especially in these hard-hit counties, go get tested. And we'll talk about this in a little bit. Remember, if you are called by a contact tracer, you have to pick up the phone. We're seeing a drop-off and people being willing to pick up and to follow the instructions. And that means we're seeing more people that would rather knowingly spread this virus than stop it. And the inconvenience of being in quarantine, I've gone through it. I've done it. We need everybody else to do it too. The potential ramifications of not doing it are unacceptable. And know somebody very well that was almost 10 days into a 14-day quarantine with her husband, and her husband just tested positive. That's how important it is to follow all of those guidelines. All right, quickly want to talk about CARES Act funding. This is funding from the federal government, almost $1.6 billion that has to be expended by December 31st. Want to be transparent about how we are spending it. First, through the end of the year, we will spend a little more than $219 million in PPE, testing, contact tracing, and public awareness. These are things that you absolutely have to fight this virus. Think about the PPE that we had to provide, especially in the difficult times, the buildup we've had for the surge. These are all the test kits used in all of those areas I just talked about, and many that we ship to hospitals. There's also the expenses of state and local governments and our local health departments that have been reimbursed. These are above and beyond expenses, or first responders who much of their work has been dealing with this pandemic. There is a typo on this. It's a little over $400 million. State government, $300 million, not 30, in city and county. $46 million extra to our local health departments. $7 million we provided to help run elections in a safe way. Education has gotten significant dollars directly from some of these packages, so this is just on top of that. States provided an additional $20 million to public post-secondary education. That'll help them with a lot of expenses that they have borne, extra testing, extra steps, along with $8 million that we have put in to try to reach that last percentage of kids that have online connectivity problems, especially when we're asking for virtual learning during periods of red county and red zone recommendations. Long-term care, we've put over $102 million in to better protect our seniors in these facilities. That includes some of the most robust testing we see in the entire country, nurse strike teams that can come in and help in times of need, and a lot of other support. And then when we look at providing relief directly to Kentuckians, $298 million in unemployment insurance benefits, the extra $400 that we put out there, improvements to the system to try to reduce our wait times. $33 million on eviction and utility relief and meals for seniors. $2.9 million. This was a request from our child advocacy centers, our domestic violence shelters, and others that are caring for folks in crisis that needed a little extra help. We're going to be using $2 million that was requested for meat processing facilities from our from Ryan Quarles, who heads our Kentucky Department of Agriculture. That was a request that between him and our Governor's Office of Agriculture Policy can help make sure that supply chain stays intact. So we're going to be able to do that with him. And so, again, you see not just transparent, but spending on the needs. You see it being done in bipartisan ways, election expenses. That's to help make it safe with our agreement with the Secretary of State. A request by our State Agriculture Commissioner supporting local governments at very close to the level of supporting state government. So that's a quick breakdown there. We're now going to go to the Secretary of the Cabinet. He's the top appointed official in the state, Michael Brown, who's going to give us an update on COVID outbreaks and management of it in our state prisons.
Thank you, Governor. I know that last night there was a question about how things were going at Little Sandy. Last week I had reported that we had 263 cases there. That was our latest hotspot, if you will, in the correctional system. The good news is that Little Sandy is flattened. We had 263 last week. We are showing only 264 cases today, only 125 which are active. But the virus persists to try to get into our system, and we've seen now a new small outbreak at Bell County Correctional Facility, and which is one of our most remote correctional facilities. We have 87 new inmate cases in Bell County. Overall, we're showing only about now 214 active cases in our system, and almost all of those are accounted for between the remainder at Little Sandy and those at Bell County. So our systems for dealing with COVID seem to be working. Green River, the reformatory, the correctional facility for women have all flattened out, but the virus continues to pop up in certain places. Thanks to the Frankfurt Health Department, Dr. Stack, and some testing materials we received from the federal government, we are going to be sending 50,000 of the avid bimax rapid test kits to our prisons so that we can test our staff. That's 50,000, should give us about a 90-day supply. We're seeing that sometimes these cases are coming in as our staff goes out in the community. We know we're having community spread. We're going to implement that new test system for our staffers, not just to keep them safe, but to also keep it down in our facilities. So we jump on it as soon as it comes out. We manage to flatten it, but it continues, just like in the rest of the Kentucky, to pop up again. We only have 2 inmates who are hospitalized at this time out of those 214 active cases, and neither one of those are on ICU. So we're on it, Governor, but it's chasing us. So thank you.
Thank you, Secretary Brown. Again, a very difficult report today, and it's dangerous out there. So please be careful, if not for you, for those around you. We're going to open it up to questions today. We have 1, 2, 3, 4, 5, 6, 7 people we'll hear from live, and I've got about 1, 2, 3, 4 written questions. So let's start with Mike Valenti from WLEX. Mike?
Hi, Governor. I know with a tough day today and with the metrics trending in the wrong direction, how has your thinking changed? I know you said before that you believe encouragement is better than enforcement and more effective, but when would enforcement be warranted?
We obviously encouragement is what's going to get us there, as more people who are willing to do it. But I'm starting to hear from a number of local officials as well that they believe that more enforcement will help get a better result. And with this thing out of control, they want to be a part of that solution. So we are looking at various options right now for localities that want to do some of the same enforcement that our labor cabinet would do, for instance, to help them with that. We're to the point now where everybody, every leader that is out, when you see something that's not being done right, you need to say something about it. But with 6.5% positivity rate and 2,300 cases, we better start doing this thing right. Otherwise, our numbers of choices are going to become fewer and fewer and how to effectively address this virus. Karen Czar, WUKY.
Good afternoon, Governor.
Are you there,
Thank
Karen?
you. Yes, can you hear me?
Yes,
Hello? Oh, great.
I can hear you.
Kind of piggybacking off, thank you. Piggybacking off of Mike, are you reaching a point where you are considering moving past encouragement to mandates again?
Well, right now, our public health officials and the White House, and you can see their most recent recommendations online, kycovid19.ky.gov, believe we have the right mandates in place. But again, a mandate is only as good as the number of people who will follow it. For instance, the mask mandate can and should be incredibly effective in fighting this virus. And when we first put it into place and we had better compliance, you saw the difference between us and Tennessee and how cases increased. It's when that compliance dropped that the difference in cases has started to narrow when you adjust it for population. And so again, I don't think at this moment it's an issue of more mandates. It's an issue, that's fair to say, encouragement and enforcement to get people to wear the darn mask and to follow the rules and not to have a giant adult Halloween party like we seem to have seen pictures, not to in red counties to have big Breeders' Cups parties. It's a great event this weekend. I want as many people to watch and participate as possible, but do it in a safe way. And for restaurants, bars, for retail establishments, I know enforcing the mask mandate is hard, but if you're not doing it, it's not safe for your employees and it's not safe for the people coming in. We just need more out of everybody. Tom Latek with Kentucky Today, who today did not get the first question.
Yeah, Governor, I was wondering if I didn't get on base enough so that you dropped me down in the order some. My question is, with 2/3 of our counties now in red, did any drop out of the red from last week?
That's a good question about whether any dropped out of the red from last week. My belief is the answer to that is yes, but we would need to do a direct comparison on that. This being the first week of the red zone recommendations, it may take 2 weeks for a community to get, we hope, from red to even yellow. But if these communities will stick with it, we believe that is possible. And then it's a lot harder to move back from yellow to red as opposed to from orange to red. As I look through here, I believe at least we had a couple that have switched in and out. I don't recall if Scott was red before, it is orange now. I think that might be one example. All right, next, Stu Johnson from WEKU.
Thank you, Governor. You talked earlier in this briefing about some people not responding to the contact tracers. How or if and how is that affecting the spread of the disease?
Well, it definitely affects the spread of the virus. Every professional would say that to truly stop this spread, you got to have testing, and then you got to be able to reach everybody who tests positive, get them to agree to do the full contact tracing, and then everybody that is in the high-risk area agrees to quarantine. And this is from Dr. Stack. We're having more reports from around the state of more citizens not answering their phone, not answering the questions, telling tracers they don't have contact with anyone, and other related issues, but it's not localized to one region, and it's not unique to Kentucky. State health officials from other states are reporting similar challenges. Mark Carter, who is heading our contact tracing, said they've noted a declining number of contacts per case across the Commonwealth, and not just in Lexington, because we got a question from the Herald Leader on this too. Right now, for the 30-day period that ended October 15th, where they do identify contacts, they're reaching 62.1% of them identified as high risk. While we don't have that same type of data from earlier in the pandemic, our belief anecdotally is we were previously reaching about 80%. So we need people to answer the call. If you stick your head in the sand and say, maybe I have it, but if I don't pick up my phone, nobody has told me that I have it, or if I pick up my phone, I have to quarantine, and you actually have it, you could be infecting a ton of people around you. One study said one asymptomatic infected person that doesn't quarantine could infect up to 400 other people. Those are other people's brothers and sisters, mothers and fathers, kids, grandparents. No, don't do that. John Boyle from WFPL.
Hello, Governor. I wanted to just build off that last question. With people not answering phone calls for contact tracing, I know a lot of people personally don't answer numbers that they don't recognize. I even do it on my day off personally. So I'm wanting to know, have there been alternate routes considered, such as texting? And also, I wanted to know if there was any specific data on just how far behind we are on contact tracing.
Let me answer the last piece of that first. We'll try to get you exact data. But even with how we built up contact tracing, with 2,300 cases, if we have them a day, there's no way we can keep up. And not even close with that amount. In addition, with what the local health departments are being asked to do to input data, though we're going to have an update next week about how we're going to consolidate some of that and free up more time for them, they're overwhelmed. With this amount of cases, our state contact tracers and our local health departments are overwhelmed. Now, they are fighting the good fight, and they're showing up and bringing it every day, even though they're tired. And we're grateful and we love them for this selflessness and the effort they're putting in. But we got to have a lower number. We got to have many, many, many lower cases if we're going to effectively trace and quarantine. So again, you can view those red zone recommendations as a way to get the levels down enough to effectively contact trace, to get the levels down further. We'll see if we can get you specific data on that, but the plain clear truth, which I've been committed to the whole time, is at this level, not even close to being able to contact trace all of them. We're going to have to prioritize, and we're talking about this now, about contact tracing high risk individuals or situations that appear high risk, and there could be a number of factors in that. We'll have Dr. Stack talk about that on Monday. Melissa Patrick from Kentucky Health News.
Hello, it's Melissa. Are you there?
I hear you.
Well, great questions today. Many of them were mine. But I would like to expand on the contact tracing, wondering, I feel like many people don't answer the call or contact or a group. They simply can't because of work. They need a paycheck. They can't take 14 days off work. So what do you say to those people, and what supports are there in Kentucky in such a quick turnaround to help those people?
For those first responders, for instance, we have workers' compensation. We did that through executive order. And obviously, if the legislature changes those powers, it would impact that ability. But early on, we were talking, and we think a lot of employers have complied, that you have got to give paid sick leave to your employees right now. If you don't, there are some people who are going to make the decision to come to work, showing symptoms, not showing symptoms. We had talking to a member of the local health department that had 4 positive people on one day that she called, and they were at work, and they'd gotten a test because they were feeling bad. Our employers, it is for your own best interest to provide this, because in each of those instances, there are now dozens of people from that work quarantined. Meaning, if you provide that paid leave, if you just do the right thing here, you protect other workers around you. And you got to do what we're telling everybody from school through state government to do, is if you feel sick at all, do not go out in public. Do not go to work. It is a real problem, and it could harm other people. I know John had also asked about other means. I do believe we have texting capabilities, but we've got to continue to try to refine that. It's a good thought, and we'll follow up on other ways that we're trying to do that. We need to try to find as many ways as humanly possible, but then we also have to get people to do the right thing, especially with where it is right now. Debbie Yetter from the Courier-Journal.
Hey, Governor. Do you all, at this point, with these rising numbers seeming by the day, do you all have means of projecting where you think the state is headed, and what kind of growth are you all foreseeing, if that's possible?
Debbie, we don't have the same type of modeling that people were trying to do early on. We're still looking at how fast this growth is based on when we went from 1,000 to 2,000. If it was the same time period, we could be at 3,000 by if not the end of next week, in the middle of the week after that. But again, we went to 2,300 pretty quickly. Now, remember, we had 1,600, which is still a huge amount yesterday, but we believe that might have been a little lower due to Election Day. This might be in part of it, making up for that. So it's going to take us a couple more days to see. And then different parts of the country, while we start seeing the exponential growth, which we're seeing, we think we're seeing here in Kentucky, the growth has been a little bit different in each place. But what is really concerning for us is the pace of the growth of new cases, but also the corresponding growth in hospitalizations, in ICUs, and ventilators now. And that's going to directly correlate to more deaths. All right, I'm going to go through a couple of the written questions. Al Cross says, Senator Robert Stivers tells me Senate leadership sent a letter 6 weeks ago asking for a private meeting with Dr. Stack and hasn't received a response. Dr. Stack has testified in front of legislative committees almost every week for the past 4 or 5 months. He hasn't been treated very well for a guy that has left a lucrative practice and given it his all, heart and soul every day. It's virtually unprecedented that all of one party's leadership would ask for a private closed-door meeting with a member of an administration without anybody else there with them. It's something I would never ask for one of their employees. We are happy to work with them. Just got to be in a positive way. And we are seeing people in Dr. Stack's position resign all over the country for the way that they've been treated. I got to make sure that doesn't happen here. He is too valuable. He is given too much. And yes, sometimes I'm going to take steps to make sure we're protecting his mental health, just like he tries to protect ours. Again, we're happy to do various briefings if they are requested in a positive manner with multiple members of the administration that can provide various responses. Not willing to do closed door meetings where gotcha can be played. Chad Hendrick, WSAZ, asked about Boyd County, which is now in the red, saying that the local health department had some more cases published earlier, I guess in this week. This is one of those times where, again, it's got to get from the local health department to the state. And right now it's just health departments being overwhelmed with contact tracing, data input, testing, and everything else they've got to do. Our upgrades on Monday ought to help that. But again, it's when there is this much virus, there is that much work, and there's going to be delays. The answer to all this is to lessen the amount of the virus. Am I concerned about COVID spreading because of people lined up at the polls on election day? Most of what I've seen from election day was pretty positive, with almost universal masking. And so we'll be able to watch this. If we don't have any reports or contacts that we can trace from people standing in line universally masked, trying to keep some distance, that'll tell us something. Now, it's something that we know, that wearing masks works, but we'll have an example with tens, if not hundreds of thousands of Kentuckians that prove it. All right, we'll go one more time through all the very patient reporters that are with us live. So back to Mike Valenti from WLEX.
Yeah, Governor, regarding the presidential election, we saw the president come out at 2:30 in the morning, Wednesday morning, and falsely declare victory and demanding a stop to the counting of ballots. UK election law professor called that an existential threat to democracy. What did you make of the president's premature declaration? And as a lawyer in training, how do you react to these lawsuits that the campaign is filing across the country?
I'm a lawyer in training, but I have frozen my law license for this period that I'm serving as governor. Every vote counts. Everybody counts. And every legally cast vote needs to be counted. I don't think that there is much of an argument there, even between people of various parties. So count them all. I was asleep by 2:30 that night, though I didn't sleep many hours that night. But I think it's incredibly important in this country that we count all the votes. Now, it's going slow. It's going really slow. But if that's what it takes to make sure that that people did their civic duty and cast their vote, then good. Karen Czar.
Governor, I'm already seeing this question pop up, so I want to clarify for myself and everyone. Is there any chance that today's high numbers are because of any potential lab closures because of Election Day, or are these numbers accurate?
Well, first, the numbers come in when they come in, and these we don't think that there's a lot of delay in this. Could today's high number be that yesterday's number because of an Election Day delay? Could it be that yesterday instead of 1,600 there were 1,800, and today instead of 2,300 there could be 2,100? Sure, but we'll see that over the next couple days. But remember, even on Election Day itself, we had a really high number. And if labs were closed and it was making a big impact, we wouldn't have had 1,600 yesterday. But the data will bear it out. And that's why we use the 7-day averages and we look overall, because it smooths out any of those things. But just look at Monday. I think this last Monday, we had the highest Monday ever. And so you can compare that with previous Mondays, even with lab closures on Sundays. So, we can't rationalize or deny our way out of the fact that we're in a rapid escalation of COVID-19 cases in Kentucky. Tom Latek.
Thank you, Governor. I've been getting texts ever since you made the announcement from, folks in the food service industry here in Frankfort. Can you clarify who is and who is not eligible for that fee waiver for their licenses?
Right. I will give you the information I have, and we will try to further clarify it in our release. So it is a 12-month relief on alcoholic beverage renewal fees. And I know this applies to restaurants, bars, and temporary venues. And what it means is for those that have not paid 2020 yet, they don't have to until 2021. They went ahead and paid 2020. The fees will be waived in 2021. But the fee waiver does not apply to producers, distributors, wholesalers, and others who are able to continue operations through the state of emergency. And we'll further work to clarify with various groups moving forward. We want this to help, and it's designed to help those that were hit hard during this. Stu Johnson.
Governor, regarding testing with the case levels as they are right now, does that change who should be tested and how often?
Oh, I think everybody should be tested at this point. If you are in a red county and you haven't gotten a test in the last 2 weeks, go get one. There's that much exposure out there. If you are in a red or an orange county and you have contacts with lots of people, go get one. I'm tested at least every 2 weeks. Got another test today, so it's really important. And this is everywhere. I know probably 20 people right now that are under quarantine. So I would suggest, first of all, if you feel sick at all, for any reason, even if you think it might be allergies, don't go into work that day. Get a test. Work virtually until you get the test back. Then again, if you've been around anyone that tests positive, you'll get a call that ought to walk you through. If you've been in very close contact, you need to quarantine. If you've been in more remote contact, go get a test. And again, monitor yourself until then. But everybody ought to be thinking about getting tested every couple of weeks around the Commonwealth right now. And we have the capacity. Now, you can check on some places if you think kids need to be tested. There's also a throat test now, which is a lot more palatable, I can say, to a 10 and 11-year-old, because I have some experience there, than the nasal test. John Boyle.
I wanted to talk a little bit about hospitals. Yesterday, Dr. Stack mentioned one of his bigger concerns was hospital staffing. But in Jefferson County, our officials are telling us that we're potentially 3 to 4 weeks out from reaching capacities. So I wanted to hear what that means for the potential for the field hospital, because I know you mentioned that it's 7 to 10 days for that to be set up. So I wanted to get some statewide overview of what we're seeing for hospitals, and also any thoughts on when that field hospital might go up.
So on hospitals, there are a couple of different steps. Number one, if it's not staff, if it is bed capacity, each hospital system has a plan for how to enlarge that capacity, typically within the walls of their own facilities, where they can convert space to more beds. And as we look through the plans on that, we believe that there is some significant additional capacity there, and having somebody in a hospital, if it's fully staffed, if they are not in critical care, it's a good place for them to be. Again, if they can't simply recover from home, at the point where we reach those critical levels, there are a couple other things that we can and will do. Number one is set back up the field hospital. Certainly, the Louisville area is a key indicator to that, and would lead us to setting that up with enough lead time to be ready. Again, I think that's 7 to 10 days. So what we do, if what you're hearing is correct, is continue to communicate with the hospital systems in that area, but have them communicate with other hospital systems too. So if, for instance, Louisville's starting to fill up, but there's room in Hardin County, or there's room in Lexington, that may be a better environment than the larger field hospital. So we have asked hospital systems to work with each other like never before, and they are doing it. We're already seeing some real positives there. But we'll be watching that very closely. But it's not a current capacity just in one area that would set the decision to set up the field hospital. It'd be, you look regional, and then you look at the potential expansion plans that our hospital systems have been doing a good job on. But let's go back to staffing. Just because you can add a couple hundred beds doesn't mean you have the staff for them. So if what we hear is, yes, we can add the beds, but we don't have the staff, yet we're able to staff a field hospital, then we look at either supplementing the hospital systems that are there in different ways, and or going ahead and setting it up. But these are decisions that will be made in real time, but I'll be here Monday through Thursday to talk about them as we go. Melissa Patrick.
Hello. So the FDA issued an alert November 3rd warning that those rapid antigen tests, like the ones being sent to the prisons, are they
Yes.
can produce a good number of false positives, and they were also not really designed to to be used on asymptomatic people. So why is that a good option to monitor these congregate settings? Why are we, what's going on with that?
So from the very beginning, from when the federal government said that they were going to send them to us, I've been talking with the public and with y'all on the fact that they have the highest error rate in cases, in tests that are out there. And so what we've talked about is we can find a use for them, but we have to know their limitations. So our plan is to use them to supplement. In other words, we're already doing a large amount of PCR testing, and that's the most accurate test in our prisons with our workers that come in. What we're going to use these is as a monitor on top of those. It allows us to do extra testing to cut down on the period of time, the gap in which people get tested, but knowing its limitations. So if somebody does test positive on that, we will send them out for a PCR test, knowing that we need to get confirmation of it. So what we have is a tool, and we have a lot of it, and we know it's not the best tool, but if we're smart about it, recognize and understand the limitations, it can at least help us with a little more monitoring. But that's also why, for instance, we haven't sent these out widely to a lot of other places, because every place that they are, it needs to be very mindful of what they are and what they're not. The prisons, with the direct communication with the state government and the Department for Public Health, we're also going to get a lot of direct data back on how to make the system work the best. With that, I don't want to say lack of accuracy, but less accuracy than a PCR test. So that, for instance, if we can get this right on knowing how to use it, it could potentially even be used in schools to improve safety. But it's the reason that we haven't sent them to schools, certainly yet. Debbie Yetter from the Courier-Journal to finish us off.
With 80 counties now in the red zone, do you have any means of tracking how well they're doing in complying with the guidelines, or are you just sort of hoping for the best?
Well, we're doing more than hoping for the best, but again, with the volume, it's hard to track. The way we mainly do it is through our local health departments, which are working with multiple counties. And so we get our reports back from that. We have some communities that are following this to the letter. We have some that are following a little bit of it. And then we have some that are doing a whole lot of it. But I will tell you, Debbie, that we have seen some communities that maybe early on had they and I had some real disagreements on what was necessary, come to the table and say, we want to do even more. We've got to get a handle on this. And we're seeing a number of those around the Commonwealth. We'll reach out to the local health departments to try to get a more accurate count of that. Are we hoping for the best? Well, sure, but we've got to be able to expect it as well with the cases we're in. But my message to each of those counties is it's dangerous, and your people and their lives and health are on the line. So now is not the time to do the right thing because I've asked you, or you're worried that I'll show a picture or say you can't be doing that. It's a time where if you don't do it, you're going to lose people in your community. It's necessary. We are under attack. And we've got to respond with those public health measures that keep people safe. All right, folks, this is a tough way to end this week. I wish I didn't have to tell you about 2,300 cases or 20 deaths, but it's where we are. And we need everybody on board. I mean, it's silly to be having conversations about what's going to be torn back or where these rules or regulations are going to go. They're necessary. The White House says they're necessary. Your local health department says they're necessary. Dr. Stack says they're necessary. And we are awash in the coronavirus. Please take care of yourself. Stay safe. And if a community isn't following the guidance, you do it. I want you to be safe. I care about each and every Kentuckian out there. every single one. I care about you if you're wearing a mask. I care about you if you're not wearing a mask. I really want you to wear a mask. And I'm not trying to tell you to do it because I want to invade your liberty. I'm doing it because I want you to survive this thing and not harm anybody else. Listen, whether or not you agree or disagree with me politically, voted or didn't for me, I don't care. I don't care about any of that in the midst of this. I just want to get us through this. And I want us to all get through it together. I mean that because even if you spend most of your day attacking me on Twitter, I want you to get through this. That's my job as governor, and that's how I was raised. So please, let's put some of the other stuff aside. Let's make sure that we protect one another. We're going to get through this. We're going to get through this together, but we need everyone, all together. Try to have a good weekend. If you were in one of those red counties, show leadership. You got until Monday to prepare for it. Let's tamp down those cases in your community. Let's protect everyone around us. That's we're called upon by our faith, our values, and our duties as a citizen of this Commonwealth. Thank you.